is your heart, a machine that beats more than 100,000 times per day. Imagine that one night, your heart starts to beat like crazy and does not stop. You cannot sleep, you cannot run, and your life is in danger. This is a cardiac arrhythmia. Cardiac arrhythmias will affect 1 in 3 adults. More than 10 million Europeans do suffer cardiac arrhythmia. In 2021, almost 70% of heart arrhythmias cannot be cured, and they cost more than 200,000 million euros to the European Union every year. What if we could improve this situation? What if cardiac arrhythmias become a curable disease? This is the goal of ITACA-COR research group. We are a team of electrical and biomedical engineers developing technology to understand cardiac arrhythmias and to provide valuable tools to clinicians to help treat their patients.
Nowadays, fundamental mechanisms of initiation and maintenance of arrhythmias remain unknown. Antiarrhythmic drugs fail in more than 60% of patients.
In the area of fundamental research, in ITACA-COR, we collaborate with biologists and clinicians in the characterizations of cell cultures from human pluripotent stem cells.
These cell cultures allow us to improve our understanding of the ionic current interactions that affect cardiac tissue. This will be the target of novel biological antiarrhythmic treatments.
In the meantime, the most effective treatment today is to introduce a catheter in the heart and make a surgical intervention that stops the origin of the arrhythmia. However, today all patients are receiving the same surgery, pulmonary vein isolation, although it fails in more than 40% of cases.
This is because clinicians are lacking the technology in order to personalize the treatment for each patient. They lack of tools in order to identify the cardiac region that originates the arrhythmia. Our algorithms will bring the atrial fibrillation driver identification closer to the clinical practice.
In ITACA-COR, we developed electrocardiographic imaging technology, a high-density mapping system that allows representing non-invasively the electrical activity of the heart. This standalone, non-invasive mapping is a reality thanks to more than 15 years of continued improvement of signal processing tools.
We are studying regularization techniques that allow the estimation of the origin of the arrhythmia without the need of surgical interventions.
We have developed photometrics algorithms that allow the reconstruction of the thorax and the heart without the need of medical imaging modalities. We make our technology available to everyone and useful to all.
We apply machine learning techniques to predict the most appropriate treatment for each patient by evaluating different clinical variables and electrophysiological information. Our cardiac digital twins allow us to test different treatments and support clinicians in the decision-making process.
All these improvements have been made thanks to our continuous work and collaborations with clinicians, international research groups, and the industry.
In ITACA-COR, we will continue working hard to make sure that if your heart starts to beat like crazy, your clinician will have the most effective treatment.